Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation today is 5 simple steps to lower your blood pressure quickly and naturally. Let us try to understand why we get sudden spikes in blood pressure. The sudden spikes in blood pressure is predominantly related to acute sympathetic stimulation. As you know, the body is controlled by two hormonal systems, namely the fight or flight system. The fight is the adrenaline system, which is the sympathetic system, and when the sympathetic system gets activated, like you're sitting for an interview, very anxious, or you're waiting for a surgery, you're anxious, you're waiting for a train which has not arrived on time and you're going to miss your connection. So all this anxiety creates the sympathetic drive. And let's understand what happens with the stimulation of the sympathetic system. The stimulation of the sympathetic system leads to pupillary dilatation. It increases the heart rate. It increases the contractility of the heart. It constricts the blood vessels. As a result, it increases the blood pressure. It also causes increased respirations, perspiration, sweating. And those are some of the major cardiovascular events. So when your blood pressure is going up because of anxiety or stress, it is related to increase in heart rate. It is related to increase in vascular resistance. That is, the arteries become more stiff. That increases the blood pressure, and along with that, you get increased respirations. So how do we counteract this increase in epinephrine release during a stressful situation? In order to answer that, we have to say we have a counterbalance hormonal system in the body, and that is the parasympathetic system or the vagal effect. What does the vagal or the parasympathetic system do? As you can see here, you can follow my arrow, the parasympathetic system sort of works in opposite of what the sympathetic system does. As I said, the sympathetic system increases the heart rate, increases the blood pressure, it increases the anxiety, it increases sweating. On the other hand, parasympathetic system does exactly the opposite. It decreases the heart rate, it reduces the blood pressure, it reduces the venous return from your legs. And as a result of this, it's sort of a calming effect. Sometimes it may be too much where people pass out because of the drop in blood pressure. But generally speaking, when it is done in a controlled fashion, you can bring down the heart rate down, you can bring down the blood pressure, you can reduce all the secretions, and thus help to bring the blood pressure down. So how are we going to accomplish this? So I'm going to discuss some of the simple maneuvers we can do. 5 simple steps to reduce the stress when your blood pressure acutely goes up in anticipation of a stressful situation. Like you're trying to drive to the airport, you are late, the traffic is heavy, and you're frustrated, and that's when you see your heart rate racing, your blood pressure going up, you're feeling dizzy, and how do we counteract that? The first maneuver is known as the Wellserver maneuver. Wellserver maneuver increases the vagal tone. So that means we want to stimulate the parasympathetic system through natural means. And how do we do that? There are a couple of ways we can do. One, if we strain, like you're trying to have your bowel movement, that will help to slow down the heart rate, to slow down it will lower the blood pressure and thus help to reduce the symptoms. On the other hand, you can also close your nose and blow against your nose, which increases the intrathoracic pressure, which increases the vagal tone, which leads to reduced heart rate and reduced venous return because of the increased intrathoracic because of the reduced intrathoracic pressure. As a result, you can bring down your heart rate, your blood pressure, and it also reduces the venous return from the legs. Okay, the second step I would do would be breathing exercises. Breathing exercises sort of follow the same principle of putting the sympathetic system in charge, because when you're having an anxiety attack, oh, I'm sweating, I'm nervous. But the parasympathetic system works the opposite way. When you take a deep breath in, like just follow me, hold your breath for 5 to 10 seconds. When you take a deep breath in, you expand your lungs. When you expand your lungs, it puts pressure on the venous system, so the venous return decreases. As a result, it helps to bring the blood pressure down. Then you hold your breath, then you breathe out. This reduces the sympathetic hyperactivity resulting from an anxiety episode. If you repeat this 15 times, it would definitely bring down your heart rate and blood pressure. That's step number 2. Step number 3 is cold water technique. Have you ever felt that when you are excited or you're angry or you're frustrated, your face turns red, your head feels hot, your body feels hot, and your pulse rate is up, you're sweating, and your blood pressure is up? That is all related to epinephrine and norepinephrine level. It's like fire. Your body is on fire. So how do you counteract that? Just sink your body in a swimming pool with cold water. Or if you can't do that, if you are in a workplace or at an interview, just go into the restroom and wash your face with cold water. Leave some paper towel with cold water over your head. Let it stay there for a couple of minutes, and all of a sudden you begin to feel there's like a cool breeze going through your body. And that will bring down your body temperature. It will bring down the blood pressure. So that's one cold technique. The best thing is to dip your head in a bucket full of water. If that's not available, you can replicate it by just pull out a couple of sheets of paper from the stand and wet them and put them over your head like this. And I will tell you, and let it kind of soak your head for a second, all that hot, fiery feeling that you have in your face will slowly come down, because most of these hormonal effects last only a few minutes. So if you can time over that tiny minutes, then you can overcome these problems. Step number 4 is keep the room temperature down. If you can control it, you are in a hot argument with somebody and your blood pressure is up and your heart rate is up, your face is red, what do? You turn the lights down, put the temperature down, maybe put a cold paper towel over your head and close your eyes and just try to relax. Maybe do meditation, just focus on something so that it will help for these epinephrine to sort of dissipate. In other words, the epinephrine to kind of wear off, and then let the parasympathetic system take over, which leads to reduced heart rate and reduced blood pressure. And these are all simple techniques which will be very useful in an acute situation, because that's when you're concerned about when you don't want your blood pressure to go up. That's when it goes up, and that's when it gives you all these symptoms. Meditation will help you, and when you're doing this, especially if you keep your legs up, you get into a mental state of trance, and you may even drift into a small nap, which is fine, because when you wake up, you're fresh, you are breathing normally, you're not feeling hot, and your blood pressure should be down. The 5th method is known as the carotid sinus pressure. But ladies and gentlemen, let me tell you, or let me caution you one thing. Please do not try these things on your own without the supervision of a doctor or someone else who is qualified, because these are all medical procedures which should be tried under the supervision of a professional, so that when you need it, you can use them. Especially the carotid sinus pressure is something that is of a more advanced nature, it can be serious. We had people who developed stroke by doing carotid artery sinus pressure, so be cautious. But let me explain to you what carotid sinus pressure means. Here, if you feel the carotid artery where it bifurcates into two branches, there is a specialized cell known as the carotid body. It senses the blood pressure. It's like a sensor that monitors the blood pressure. If the blood pressure is high, then this carotid sinus pressure will feel that. But by gently putting your fingers below the carotid bifurcation and gently massaging it for like 5 seconds, 10 seconds at the most, it will stimulate the carotid body, and that will help to bring down the heart rate and blood pressure. But there are few things I want to caution you about carotid artery pressure. This has been used by young people who have rapid heartbeats, known as the paroxysmal atrial tachycardia, who can do their carotid pressure, which brings the heart rate down or breaks the cycle and turns the rhythm into normal rhythm. And in young people, it may be a little bit safer to do that. But in older patients, if they have blockage in the carotid arteries, that can be a serious problem. If you press on the carotid artery, that can lead to detachment of a plaque and leading to stroke. So be careful about that and check with your medical doctor. Let them check your neck and maybe try this carotid pressure in their office, because sometimes we have what is known as the hypersensitive carotid body. That means if you just touch it, suddenly the blood pressure and the heart rate drops. So you don't want to do a massaging carotid artery which is hypersensitive. The third point is you should never do carotid pressures on both sides at the same time. That is no. So, ladies and gentlemen, this is a quick synopsis of how you can reduce your blood pressure under stressful conditions by using these simple maneuvers. For example, if you're sitting there, go to the restroom, put a cold towel, paper towel on your head, let it cool off. Then we are just sitting there, close your eyes and maybe have a little meditation, or even take a deep breath in, hold your breath and blow it slowly through the mouth. Keep your mouth open and do it. By doing these things, you're shifting your attention from anxiety to one of calmness, tranquility, which will help you to bring your blood pressure down. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and I will see you in the next presentation. Thank you.